This is our group. This is group 4. Our clinical presentation was an acute onset of expiratory wheezing and chest constriction with a non-productive cough. And then 5 main pulmonary disorder types are infections, restrictive disorders, obstructive disorders, vascular disorders, and malignancies. And then obstructive pulmonary disease is where the lungs have difficulty getting air and carbon dioxide out, especially on forced expiration. It involves chronic inflammation of the airways and can be characterized by air trapping or the inability to get air out of the lungs. Causes of obstructive pulmonary disease can include impediments in airways, narrowing of airways, or other abnormalities. Impediments can be things like secretions, fluids, and foreign material. Airways may be collapsed or narrowed from the walls, losing their elasticity, trapping air. Bronchoconstriction, gland hypertrophy, and inflammation can all be causes of narrow airway. You can also have peribronchial abnormalities such as destruction of tissue, compression of enlarged lymph nodes, or a neoplasm. Next slide. And the main types of obstructive pulmonary disease are COPD, which is a group of 2 diseases, emphysema and chronic bronchitis. Then there's asthma, bronchiectasis, and cystic fibrosis.
So with the clinical presentation of our patient presenting with a non-productive cough, wheezing, and chest constriction, we diagnosed them with asthma, which is chronic inflammation of the airways. The chronic inflammation of the bronchioles creates a hyperresponsiveness, meaning the airways are more sensitive to stimuli that would trigger an asthma flare-up. In asthma, there's also a constriction of the airway, which is what's causing chest constriction and wheezing in this patient. And there's also reversible obstructions in the airway that can be cleared with the use of oral corticosteroids. And the asthma flare-ups are often triggered by an inhalation of an allergen such as pollen or cat dander, workplace irritants such as chemical fumes, and exercise, especially when the air is cold and dry, can all trigger flare-ups of asthma.
Asthma is typically a genetic disorder. Other factors can be allergen exposures, air pollution, exposure to tobacco smoke, recurrent respiratory infections, and obesity. Asthma is considered a type 1 hypersensitivity, and there's 2 responses that are typically involved. The first response is an early onset. That's an exposure of the antigen, causes activation of T helper cells and the IgE mediators. They cause a histamine response, which stimulates vasodilation. That increases capillary permeability. It causes edema and mucus secretions that results in bronchoconstriction of the smooth muscle. Early onset typically triggers respiratory alkalosis because the patient is hyperventilating. So they're trying to overcome that obstructed airway, and that results in some hypoxemia. The late onset is a delayed reaction, typically 4 to 8 hours. Mechanisms are the same, except eosinophils are involved, and they cause epithelial damage. And then additional mucus causes mucus plugs. Left untreated, this causes scarring and chronic inflammation. It leads to irreversible damage that results in airway remodeling from fibrosis. Ventilation is typically decreased, and the lack of movement causes a buildup of CO2 and then results in respiratory acidosis. It can lead to respiratory failure and eventually death, but advanced treatments have reduced this significantly.
Asthma manifestation can range from mild to severe, with some people experiencing only occasional discomfort, while others may have ongoing symptoms that interfere with daily activities. Some of the manifestations of asthma include shortness of breath, which is one of the most common symptoms of asthma. When the airways become inflamed and narrowed, breathing may take more effort than normal, and the patient might feel like they can't catch their breath. And other manifestations include chest constrictions or tightness, wheezing, and non-productive cough. Next slide, please.
Asthma has many underlying triggers and risk factors, so it's important the patient talks with their healthcare provider to create a personal action plan that best fits the individual. Usually in acute asthma attacks, an immediate administration of O2 is needed, which can be through an inhaled beta agonist bronchodilator, which helps relax and open the airway, or a corticosteroid is used to reduce inflammation. Also, a combination of those medications can be used in one device. As for chronic asthma attacks, try to avoid those allergens and irritants to reduce flare-ups and narrowing of the airway. Depending on the severity of asthma, short-acting beta agonists can be used, and if more severe, long-acting beta agonist inhalers or leukotriene antagonists can be effective. Lastly, anti-inflammation medications and immunotherapy are shown to be helpful. And this is the end of our presentation, and we have 5 questions regarding asthma.